Hi there, I'm Dr. Stephen Phelan. Thank you for joining me on this video. What I would like to do today is describe for you a new seminar that I'm hosting and co-presenting with Dr. Jim Janikowski on September 30th and October 1st at the Fallsview Casino and Resort in Niagara Falls, Ontario. And the seminar is titled Interdisciplinary Aesthetics for Implants and Teeth. And if you're on our mailing list in Ontario, or if you're a previous customer across the country, you'll receive this brochure in the mail in the next week or so. And if you're not a previous customer and you haven't received this brochure, you can look at this online at my website, phelandentalseminars.com. And basically what we want to do is talk about the seminar today, and I'd also like to tell you about some excellent bonuses that I've put together if you register for this seminar. And basically I've set up this seminar to provide you with the best collection of bonuses I've ever put together for a dental seminar. And I'm really excited to share it with you and even show you a walkthrough of these bonuses today. So stick through this video, make sure you watch the bonuses because you'll be blown away by some of the things that we're able to achieve now. And I want to show you on my computer one of the main bonuses. So basically what we want to talk about today is interdisciplinary aesthetics for implants and teeth. And I'll tell you there's a big opportunity in our dental practices. On the screen here I have an example of 16 different cases, 16 different patients that have come into my practice over the last couple years that needed or wanted and needed fairly complex dentistry. And I'll tell you, I would venture to say that on any dental practice, on any given month, you would have 16 similar types of cases walk through your practice. And the ability to confidently know what to do to treat these cases and basically to diagnose, treatment plan, and execute the treatment, if you have a good idea about this and you recognize these types of patients, you can take your practice to another level and take the enjoyment that you have in dentistry to another level. So basically what I want to do is talk about that. And if you've been to one of my seminars in the past, you know the type of organization that we put into our seminars and the amount of training material that I provide. And if you haven't been to one of my seminars, if you could look at phelandentalseminars.com if you're watching this video on YouTube, and take a look at the testimonials section of my website. And really there are hundreds of testimonials on this website from previous attendees to my seminars. And if you look at some of them, you know, Stephen's great lecture style demystifies and simplifies complex problems. One of the best courses I've taken in years. And just scroll down here. Content and presentation highly organized. Dr. Phelan is patient, energized, and open to questions. Money and time well spent. You know, I'm very humbled by seeing what other people have said about my seminars because I've put a lot of effort and time into putting together these seminars, and to have really nice things said about the seminars and to find out that they've been positively helping people in their practices means a lot to me. So just spend a few minutes. You know, there are hundreds of testimonials on this website, and if you've never been to one of my courses, I think it would be good to just double check the testimonials and have an idea of what is being said about the type of material that we put together. Now, if you don't know me, basically I'm just basically a restorative dentist in Oakville, Ontario. I opened my practice from scratch when I was graduated from dental school because I'm left-handed. I didn't want to work in a right-handed operatory. So I thought, well, I'll open my dental practice right from scratch, right out of dental school, 25 years old. And that was 19 years ago. And the first few years, you know, you're right out of dental school. You don't have a great idea what you're doing as far as anything complicated goes. You know, I was competent at basically drill and fill dentistry, some simple crown and bridge, denture therapy, but anything beyond that, I had no idea what I didn't know, essentially. And I was fortunate to happen to go to a lecture at the TACD by Dr. Robert Nixon, And I was blown away by what he was doing in his dental practice. I couldn't believe that you could even get results like that for patients, let alone execute that kind of treatment at that level of detail. So at that point, I said to myself, I need to go out and learn how to do dental treatment like that. So I spent the next 5 years taking so many different continuing education courses. I went out to Seattle so many different times going to the Dr. Koiz's courses. I went to all of Koiz's courses almost in a year, and back and forth to Seattle taking these courses, and they were fundamentally changed my dental practice. And then I decided after Koiz, I thought, well, what do I do next? I'll go to see Dr. Spear. So I went to Frank Spear's courses in his office in Seattle. So I was getting a lot of air miles going back and forth to Seattle. And then I decided I wanted to do my AACD accreditation. So I took the accreditation preparation course at Baylor by Dr. Eubank and Morley. And then I decided after that, I achieved my accreditation. I passed everything on the first attempt, which was really nice because it's kind of a stressful procedure. And then I decided, what am I going to do next? I went to take the Dawson courses. So after that, I decided to go to San Francisco and take Pascal and Michel Magnier's course at the IDEA Institute. And that's kind of what took me to another level of aesthetic and implant dentistry. It's mostly aesthetic and occlusion dentistry. I didn't really take as many implant courses at the beginning. But basically what I did was I took a lot of the different concepts from these unbelievable mentors and distilled them into a system that works in a regular dental practice. Because I have a basically regular dental practice. This is the consultation room to my practice. I have 6 operatories. I have 3 dental hygienists. It's just basically an everyday practice, but we get an opportunity to treat some of these really interesting, complex cases because of I think the training that I've had and my ability now to recognize these kind of patients and I guess ultimately attract these kind of patients as well. So, that's kind of my story. I've also taken a lot of implant training the last 5 years, because implants was the next thing that I really wanted to master. So I've been out to IDEA again to learn from Dr. Dennis Tarnow, Dr. Kurt Pasquinelli. I went to Switzerland to learn from Dr. Belzer and Dr. Boozer. And I've just taken a lot of time learning implant dentistry. And I've developed a technique or a system for using guided implant surgery with the Simplant platform and do minimally invasive implant surgery. And I'm going to be sharing this with you in detail at this new seminar. And basically, what we're going to do with the seminar is I'm going to speak on the second day, but on the first day, you're going to hear Dr. Jim Janikowski, and he's going to speak for the entire day. And Jim will blow you away with his material. Jim was a restorative dentist for a number of years in Toronto, graduated from University of Toronto a few years after me, and he decided he had a different calling in his practice life. He wanted to become a periodontist. So he went to the University of Washington grad perio program, which is probably one of the best programs in the world, really, for perioprost training. That's where John Koiz learned, Frank Spear learned. A lot of legends in the field of dentistry have gone through the University of Washington grad programs. And so Jim was a very talented grad student, and Dave Matthews, who is the periodontist with the Spear, Kokich, Matthews group that worked together, recognized Jim's talents and asked him to come work at his office and eventually buy the practice. So Jim works with Dave Matthews. He's bought the practice. Dave's now his associate. And he also works with Greg Kinzer and Vince Kokich Jr. So they're kind of the junior Seattle group based on, Spear, Kokich, and Matthews. Now it's Jim, Greg Kinzer, and Kokich Jr. So he gets the opportunity to work with some very high-level dentists and very high-level patients. And Jim's going to share with you basically strategies to optimize aesthetics for anterior tooth replacement. And he's going to talk to you about perio-ortho considerations, perio-restorative considerations. He's going to talk to you about techniques to optimize soft and hard tissue for implant cases and restorative cases, even as Pontics. And he'll be sharing with you also one module that I asked him to put together would be basically best practices for the periodontal patient in 2011, because I thought it would be great to hear from somebody at that level what they're doing to just help patients with periodontal disease, not even just these kind of complex patients. So Jim's going to spend an entire day showing you his material and sharing with you his knowledge, and it's going to blow you away. I've worked with Jim a little bit, and I've shown some of the cases that we've done together at some of my past seminars, and people were just blown away by the skill that he has. And so I'm really excited to have Jim come to the first day of this seminar. And then in the second day, I'm going to talk about strategies to optimize aesthetics for complex cases. And the way that I thought about how I'm going to present this material, I thought I would do a deviation from the way I usually present seminars. The way I'm going to present this seminar is through case studies. And I'm basically going to take these 16 different cases that I've treated in my practice and walk you through step by step the treatment records that we took for the case, the case presentation for the case, the actual treatment of the case, and then I'm going to talk about, you know, what maybe didn't go quite as well as I'd like, what went really well, and what I would do differently given some hindsight and some time away from the case and new technology that's developed over the years. So it's going to be a really interesting seminar. It's going to be totally different than anything I've ever done. It's not going to be quite as theoretical. It's going to be more practical with video and photos of these cases, because I've photographed and videotaped their treatment fairly extensively. And the cases that I'm going to walk you through are different types of cases. This is a patient with central incisors that were going to be lost and would need tooth replacement. And he's missing a large segment of the buccal plate. So I'm going to share with you how we managed this patient. From start to finish, how we managed the tooth extraction and preservation of the ridge, how we managed the implant placement, because I placed the implants for this patient with guided implant surgery, and then how we did the restorative dentistry. And then this patient who's missing a lateral incisor has a soft tissue defect, how we managed this patient to present or to place a dental implant with guided surgery and soft tissue grafting at the same time in a minimally invasive manner, and how we managed the restorative and aesthetic dentistry. And then a patient like this with a fair amount of crowding that would really probably be best treated with orthodontics but does not want orthodontics. How will we help that patient? This patient, a missing central incisor. This is an interdisciplinary case that we treated with the orthodontist and with Jim. Jim did the implant surgery for this patient. Another interdisciplinary case treated with the orthodontist, the orthognathic surgeon, and myself. Another case, a really interesting case, that the patient came in with over-contoured veneers. They were more like crowns that were treated in the States. And a lot of tooth mobility, and how we managed this deep overbite and the amount of tooth mobility she had. Another full mouth case with deep overbite and extreme wear. A case with a lot of anterior crowding and really disheveled incisal and occlusal planes, how we managed that for that patient. This patient actually came in a few years after treatment and told me it was the best money she's ever spent on herself, having herself treated by us with aesthetic dentistry and restorative dentistry as well. Another interesting case to look at, a single central that's discolored on a basically a 18, 19-year-old girl. How would you manage this case and treat her as conservatively as reasonably possible to get an excellent aesthetic result? We'll show you this case. Single central incisors are a challenge, and I'll share with you a lot of different tips to make this work. Crowding case that will accept some form of limited orthodontics but also wants veneers. Another full mouth case with uneven occlusal planes and gingival levels. A case that does not want orthodontics but will accept porcelain veneers and needs some implant crowns replaced. Another patient with missing central incisor on the lower. How do we manage the bridge work? And he's a high-level demanding aesthetic patient. How we can get an optimal aesthetic result. This is an interesting bridge case with an extraction, and what I want to share with you on that case is start to finish how we treated the case. It was a full mouth case, but how I managed the extraction, the pontic site development, and then the actual pontic development for the fixed bridge, because this is a bridge case. A severe erosion case, I've got a number of severe erosion cases, and I'm going to share one with you. And then this case, which has multiple missing teeth, and a tooth that needs to be removed with severe bone defect due to infection. And then what he wants is he doesn't want to be missing teeth at any point during treatment, but he needs staged implant surgery because of the need for some bone grafting. How did I manage this case? Because this case went through multiple sets of provisionals, multiple stages of implant surgery. It's a very complicated case. And it's an interesting case to share with you. I've never shared this case before, but it's a $100,000 case. This is a $100,000 treatment for this patient, and I'll share with you this case in a lot of detail. Like, how many $100,000 cases do we have coming into our office, or that you've maybe seen in your practice? I haven't seen a lot of them, but I'll share with you this one. And I'm doing the case basically start to finish. I'll share with you all the different things that I've done for this patient. So those are the 16 cases. There's a lot of information in these cases that will share with you a lot of different ideas and strategies for treating cases in your own practice. So that's kind of what I'm going to talk about on day 2. And basically, you know, if you put together what I'm going to talk about, what Jim's talking about, and if you looked at the amount of investment we've had on his grad program and on my continuing education, you know, we've spent hundreds and hundreds of thousands of dollars learning how to treat these kinds of patients. And the cost for this seminar is basically $1,095 for 2 days. It's an incredible deal. And for team members, it's $295. And if you register by September 9th, you actually will be receiving $100 off. So it'll be $995 for dentists and ceramists and dental technicians, and $245 for team members. So it's a great deal, I think. And the bonuses that I've put together, I've got a very great program of bonuses. The first bonus, if you register by September 9th, you'll be entered into our draw to receive an iPad 2, a 64 gigabyte iPad 2. At my last seminar, everybody who registered by a certain date in February, I think it was February 18th, were entered into a draw for an iPad 2, and Rick King from Kingston won the iPad 2. So I presented it to him at the seminar, and one of you who registers will be entered in, will win this iPad 2, not this one, this is mine, but one that I go and buy, and I'll present it to you at the seminar in the Fallsview Casino. So that's the first bonus, which is not a huge bonus because I've done it before. The second bonus, which will be eligible for the first 100 people that register for the seminar, and I have to tell you, about 30 people registered at the last seminar, so there's really only about 70 of these left. Everybody in the first 100 dentists or ceramists who register for the seminar will receive this booklet that I've made up for case presentation. It's called the Smile Makeover. And I've given out little tiny booklets before, but I've never given out these big substantial booklets. And this booklet will basically help you walk patients through the steps involved in more complex cases. You know, the diagnosis, the study models, going to the wax up, the provisionals, the final case, and then the final restorations, then the final case. And it'll walk you through what I call the Smile Makeover. We have a section on porcelain veneers. The nice thing with the veneer section, I put in some pictures of veneers which show patients that they're thin, kind of thin shells. So you can communicate that to your patients. And a fairly conservative veneer preparation, so you can communicate that concept to your patients as well. I think that's really valuable because patients just don't grasp what veneers are sometimes. And then a dental implant section talks about dental implants, shows some post-surgical results. And we have the results of a complex implant case that Jim and I did. And so this will be very helpful in explaining different steps and stages in implant dentistry for aesthetic implant cases. And then a section on porcelain crowns and bridges, just to allow you to explain this to patients. This is the porcelain crown. These are porcelain bridges. These ones are metal ceramic. This one's all ceramic. So it'll help you explain that. You know, this is a great booklet for patient education, and this is free for you, but the only way you can get it is by registering for this seminar and being one of the first 100 people to register. A section on full mouth rehabilitation with an extensive series of photos for treating a full mouth rehabilitation case. So you'll receive this booklet and you'll have my permission to use this as case presentation material for your patients and to tell them and help them understand what is achievable with dentistry today. So that's bonus number 1. Bonus number 2 as well as the discount that you receive by September 9th. Now, the last bonus that I'm going to provide you with is something that we've been working on and I've been thinking about for a long time, and I want to test this out with you with this new bonus. So the final bonus is access to a new membership site that I've created. And my thought the last few years has been that the future of continuing dental education will be largely online. This way we can reach people all over the world. You know, I've put YouTube videos up that I get people commenting from everywhere in the world and ordering my DVDs from everywhere in the world because they've seen my YouTube videos. Now, to take that to a different level, you can create a private membership site with private videos that are unlisted on YouTube that are only available to people who are members of your online community. And so I've been thinking about this for a while, and I wanted to use an opportunity to try it out by giving you access to a test run of a membership type of site if you register for this seminar. Now, it's only going to be up till October 1st because there's like a few other things that I want to try out with the membership site before I go live with an online course next year. And it's going to be an online course with an online coaching program for a limited number of dentists. And basically, I want to test out some of the features that I want to offer by trying it out with all of you and getting your feedback. So this is the membership site, and it's really quite interesting. Basically, I have different videos here that are unlisted videos. You can't access them on YouTube. You can only access them on my membership site. And so this video is the demonstration for mounting models from my last seminar that I demonstrated how to mount models on the articulator. This video is a quick little video to show you how to mount or how to take a face bow recording. And the quality on this membership site of the videos is amazing. I'm really happy with that. Leaf gauge demonstration. So this video will demonstrate how to use the leaf gauge.
Okay, so we're going to put this in by Dan.
And this hasn't been released live yet, but I'll tell you, you can then ask questions under each video. So that's a great feature. You can ask questions, I can go in and answer them, or other people who are members can answer them. We also have audio. I have the entire audio from my last occlusion seminar, functional occlusion and full mouth rehabilitation, on this membership site that you can listen to at any time when you're logged in. Photography. I can actually put a JPEG image here. This is a JPEG screen capture of the photo series that I recommend you follow if you're going to be taking diagnostic records for your patients. Question and answer forum. I've actually created a forum where you can ask questions, I can go in and answer them, or other members can answer them. So this is one of the things we want to test out and really maybe develop after I close the membership site October 1st, between October to January when I try and launch my online program. Another thing that you can look at are my webinars. I've got all my webinars that I've hosted over the last year. There's 2 webinars. There's one for marketing your dental practice, and there's one that's preparation techniques for porcelain veneers. So this is the actual webinar, and you can see the video from the webinar. You can actually see the entire webinar and listen to my presentation. And the quality, again, is amazing. So this membership site, you'll actually, when you register, you'll be emailed your membership name, your username and password to access the membership site. And again, I'd encourage you to go in, take a look at all the material, listen to the audio, ask any questions you'd like. I'll be going in at least once to twice a week over the next 2 months to answer questions. And just try it out. See what you think. Consume the content. I'm actually going to try and post some more videos that'll be exclusive to the membership site in the next 2 months as well, just to test out how people like different formatted videos. So this is basically a trial run, and that's why I'm offering this to you as a free bonus for signing up for the new seminar. And you might ask yourself, why am I putting so many bonuses into this seminar? And really the big answer is, I really feel honored that Jim has decided to come lecture for my group and lecture for me for a day. And his material, as I said, I think will blow you away. And I want to serve the group by bringing Jim in, but I want to show Jim that I can attract a large number of people to listen to him, because as a dental speaker, you want to share your message with a lot of people. And I want the room to be full for him, and I want people to just really enjoy the day. And so that's why I'm putting together all these bonuses, the iPad draw, the ability to have the Smile Makeover book, the membership site that we're testing out. There's a lot of different bonuses. The bonus here is only for the first 100 people. The bonus of the iPad draw is only if you register by September 9th. But you can register and look at the membership site right up until a couple of days before the seminar. The problem is you'll only have a couple days to look at the membership site. I'd encourage you to go in and look at it right away, and we'll start the forum, the question and answer forum, because I think that'll be really interesting. So basically those are all the bonuses. That's the program. We've tried to set it up as very practical and actionable information. The information that I provide you with when I'm doing a seminar, I try to give you a very comprehensive workbook with a lot of different handouts of the different forms that I use in my practice. This is my risk assessment for complex dentistry case form. I'll walk you through each case, their risk assessment of the 16 cases that I provide. We have a materials list. I've tried to make my program very comprehensive, but also very practical and actionable. And actionable in that you'll be able to implement the material that I'm presenting. Because there's nothing better as a speaker than hearing people tell me that they've used what I've talked about and helped other patients with the material that I've talked about. So that's one of the big callings that I have as a dental speaker, is just helping other patients because of what the dentists that come to my seminars are able to achieve after getting some different ideas or tips or just concepts from what they see at the seminar, and then putting it into an actionable sequence of treatment that they can use. And so basically that's the video. There'll be a button on my website to click to register right under this video. So I'd encourage you today, click the button, register for the seminar, enter into the iPad draw, receive this booklet, and then go to the membership site. As soon as you register, you'll be flipped over to our membership site. You'll get an email with your username and password, and I'll basically see you on the membership site. It's going to be amazing. So thank you for watching, and if you have any questions, feel free to email or call, and we'll see you on the other side, basically.